Tonight, Pfizer says it could apply for emergency approval within days for its coronavirus vaccine. Pfizer says after finishing phase 3 of trials, its potential vaccine is even more effective than researchers thought, up to 95%. More than 41,000 adults received 2 doses of the vaccine. None have experienced serious side effects, according to Pfizer. Now the question is, if the FDA approves Pfizer's vaccine, will Georgia be ready? The state is finalizing its distribution plan, and Joe Hinkie walks us through it and what doctors say needs to be included for this to become successful.
At 52 pages long, Georgia has a plan for distributing a COVID-19 vaccine, and a state health department spokeswoman tells us it has CDC approval. But as of right now, it is still considered a draft because there are several unknowns about any potential vaccine. The plan calls for various amounts of vaccine to be sent to Georgia's 18 health districts based on population, level of disease, and number of people with vaccine priority. The vaccine is to be distributed across 4 phases as available. Phase 1, healthcare workers, first responders, and people 60 plus with multiple underlying conditions making them high risk. Phase 2 is school and child care workers, essential workers such as truck drivers, grocery and food processing workers, homeless shelter and jail staff, anyone 60 and older, and people under 60 with significant underlying conditions. Phase 3 includes people 18 to 30 and those in industries with moderate exposure risk, such as hairstylists and restaurant employees. And Phase 4 is anyone else the vaccine is recommended for. A priority for distribution will be mass vaccination clinics in popular high-traffic areas. The plan includes some details of education and social media outreach to inform the public.
It's so important for our leaders to come out and develop plans for public outreach.
Atlanta area ER doctor Murdad Etashami posted on his Facebook today a vaccine that is 100% effective but is not taken is actually 0% effective. He says he is hearing from people excited for a vaccine, but there are others sharing misinformation or reasons why they won't get a vaccine. Any effective plan, Etashami says, must overcome public vaccine resistance.
They want to talk about herd immunity and all these other public health nuanced kind of things, and that's not going to happen. The only way that we're going to reach herd immunity, if you will, is going to be via a vaccine.